Allow me to dispense with the usual niceties, as I believe I had done that in my chairmanship of this morning's session. Ladies and gentlemen, the threat of multiple and even extensively drug-resistant forms of TB is now an omnipresent danger in almost every part of the world. And in my country, the Philippines, we are already confronted with a substantial number of cases based on results of a drug resistance survey conducted in 2004. The prevalence of MDR among new TB cases is 4% and 21% among the retreatment cases, and that approximately means 12,000 MDR-TB cases annually, according to the Global TB Report of WHO. As of December 2008, a total of 1,435 MDR-TB patients have been put into treatment. And these figures are both alarming and significant because the prevalence rates observed in the Philippines are higher compared to the global average of 1.7 and 7.7 respectively. In a recent national TB prevalence survey in the country, the trend of MDR-TB cases showed that quality DOTS treatment helps substantially in the prevention and control of new MDR-TB cases, but the transmission continues, as shown by the increase in prevalence among the new cases from 1.5 to 2.1%. This reflects the low coverage of programmatic management of drug-resistant TB. What is currently being done to address MDR-TB in the Philippines? How are we intensifying the fight to ensure that this new threat does not derail our hard-won progress in TB control? As of 2009, the Philippine Department of Health has already come up with a country policy and technical support to implement the programmatic management of drug-resistant tuberculosis. An administrative order for the implementation of PMDT was signed to guide the health workers in the management of MDR-TB in the field level. To mainstream the control of MDR-TB in the National TB Program, or NTP, we have already scaled up investments to approximately 5 times compared to the budget of last year for the management and treatment of TB. Starting this year, 2009, the NTP budget already includes funds for procurement of second-line anti-TB drugs, the improvement of the regional laboratories and regional warehouses, training of health workers and monitoring of cases, and program implementation. We are also proud to announce that we already have competency-based training modules which will standardize the program implementation for MDR-TB. This was made in partnership with the Tropical Disease Foundation, headed by Dr. Thelma Topasi, the iconic champion of the private sector when it comes to mounting an effective fight and defense against the onslaught of TB and all of its other forms. The Tropical Disease Foundation is the prime mover of MDR-TB management in my country. I emphasize the role of the public-private mixed approach in program implementation because this approach is really the winning formula which enable us to achieve and even surpass our targets for basic TB. In reality, MDR-TB services were initially made available at the private sector through the Tropical Disease Foundation. Only later were these services mainstreamed to the National TB Control Program. Currently, we are in the process of scaling up and expanding the access to MDR-TB services. From the National Capital Region, services have moved to the southern part of the Philippines, and for this year, 10 additional treatment centers will be established. By next year, we envision that all regions of the country will have at least one treatment center. capacity building of the regional laboratories as well as infrastructure improvement will be done for them to be able to provide more expansive services. Warehousing conditions at the different regions will also be enhanced to improve delivery of second-line drugs. Right now, the challenges we face in MDR-TB control are the following. First, there is a complex strategy for implementation because it takes a long time to diagnose MDR-TB. There are multiple adverse drug reactions, and we also have the problem of defaults in treatment because of long duration and highly centralized services, which make access particularly difficult. Other concerns include the need for capacity building to have a functional laboratory network, drug procurement issues, the need to train community-based partners and health workers, and ensuring the sustainability of the MDR-TB control program over the long term. But confronted with these issues, the Philippine government, with our partners, commit to a solid and greater political will and more resolve to find solutions to the growing problem of MDR-TB. The first task will be to strengthen the basic DOT strategy so that we do not have more MDR-TB cases. The second is make high-quality MDR-TB care services free and accessible without barriers to patients. MDR-TB may represent the most formidable challenge to the global control and elimination of TB. But more so, it is a call to arms and action for all of us to act more, to act united, and to act in the most effective way that we can against a disease that grows deadlier every minute. We must fully commit all efforts to invest and scale up the needed interventions to put MDR-TB under control so that it does not become an epidemic. Thank you for the opportunity.